It's 8 a.m. from Fox 35. This is Good Day Orlando.
All right, still ahead, hundreds of thousands of Americans suffer from appendicitis each and every year.
Now, there could be an alternative treatment that doesn't require surgery. We have a local surgeon in town to explain here exactly how it works. Welcome back, 8:13 right now on the Health Watch. Each year, 300,000 Americans are rushed to the ER with appendicitis. Those patients usually need emergency surgery, but now doctors are working on an alternative. Instead of surgery, all you might need to do is take an antibiotic. In studies in Europe, 70% of appendicitis patients who took the antibiotics did not require the surgery. Well, now scientists are planning a large clinical trial to learn more about how this works. And joining us this morning to talk more about it is Dr. Jamin Brahmbhatt. He is a surgeon with South Lake Hospital in partnership with Orlando Health. Great to see you as
Amy, how
always.
are you?
Okay, so this is fascinating to me because I think a lot of people, first of all, don't even understand why we even have an appendix in the first place. And then we say, oh yeah, we'll just take it out. It's no big deal. It's like, why do we even need it? What is it? What is it for?
It's a very small worm-like structure that's actually right here at the beginning of your right-sided colon. And sometimes what happens is it gets inflamed, either because of some kind of obstruction or infectious process. There really is no real use for it because we know that when people get it out that it doesn't change anything in their body. But when it gets inflamed and infected like that, it can cause pain, nausea, and anorexia. A lot of problems. The main issue is, and the reason why surgery has become the standard of when you have appendicitis, is about a third of them can rupture and cause a lot of bad problems, long hospital stays, lots of antibiotics. So that's why surgeons are usually very aggressive when it comes to the management. But what we found now is you don't have to be as aggressive. It's still an urgent thing that's needed. But now we found is antibiotics may be a good option to kind of, if we have to wait for surgery or if we don't need surgery at all.
Well, it's fascinating because it turns out that part of the reason that they discovered this is because they were working on some Navy sailors. Is that right? Who were out to sea?
Yeah, they were out at sea and they had no access to a surgeon and like an urgent access to any immediate access to a surgeon. So they just put them on antibiotics. And they found as well, we were able to get a few days by, just keeping them on antibiotics. And that led to more studies and more trials. And this is actually something that has a pretty good movement in Europe. But here in the States, as you said earlier, we definitely need more trials before this becomes standard of care. You mentioned 2/3 didn't need surgery, but 1/3 still needed surgery.
Sure.
So what they did in this piece is they looked at 5 studies, 1,000 people, and they found that 1/3 of them within a year still needed surgery. So it sounds great, but can you imagine being that one person in that group that needed to come back and had complications? So I think the recommendation still is if you have these symptoms, you should go seek emergency care and then kind of leave it up to a discussion between you and your surgeon whether you should get surgery or maybe antibiotics is a good option for you.
Absolutely, but it's interesting to be looking at potentially the future of medicine in this area, so we'll have to wait and see how this progresses. All right, Dr. Jamin Brahmbhatt, always a pleasure.